So the Boston University Amyloidosis Center presented their early data on the role of MRD in AL amyloidosis, and it seems to have prognostic importance, predictive of major organ deterioration, progression-free survival, and time to next treatment. However, a lot of questions remain unanswered about the role of MRD in this disease. For instance, how often should MRD be evaluated, and how frequently and at what timing after treatment. The Boston group tried to answer some of these questions in our prospective analysis looking at the role of longitudinal MRD in AL amyloidosis. Some important findings were that a small proportion of patients do convert MRD status. Some patients lose MRD negativity. Amongst 5 patients in our population that lost MRD negativity, 2 went on to have a hematologic relapse, and it seemed that the loss of MRD negativity preceded hematologic relapse by about 2 years in both of these patients. So potentially tracking MRD over time might be able to predict who will go on to have a hematologic relapse. Nevertheless, relapse of MRD didn't seem to predict who would experience organ relapse. And so that remains an unanswered question, is how can we predict people that are going to experience true clinical relapse? There's also a lot of unanswered questions about whether MRD could have a predictive role in AL amyloidosis, and whether treating individuals with MRD positivity provides any additional kind of clinical benefits. So there's we're making headway in this this role of MRD in AL amyloidosis, but there's a lot of questions that remain unanswered that we have yet to tackle.